Mila, what we want to discuss today are what are the areas of your face that have started to change over the years where you feel that you have deficiencies or a change in the muscle structure.
I'm mostly concerned about the sinking here, as well as deep wrinkles that are showing up and they're closing my eyes more, as well as these lines here that I see that are deepening with every month basically. So it would be very helpful if you can recommend what to do about that and to have a little bit of a lifting and opening and freshness in the face.
Perfect. So what we find in many patients is a lot of the symptoms that they're seeing are not exactly the issue that's happening. What I mean is that I'm not going to necessarily fill these areas of the face in the nasolabial fold, but we may lift the cheek, fill the tear trough to get a slight lift in the cheek, which is going to change the lower face. We'll be able to do Botox or a neurotoxin that will open the eye and lift the edge of the eye, which will help to open the eye and lift the cheek as well. Many of the symptoms that you're seeing are very typical in patients where they're starting to see a deficiency in the lower eye or an empty space here and the skin starting to drop down. My intention is to volumize the cheek just enough to lift and pull back the face and to open the eye here. So I've just treated one side of Mila's face with the intention of showing the viewers here the difference between the two sides with the corrected side done. Of course, her neuromodulator will take 10 days before it kicks in fully, but this will at least give us an idea of how the filler has lifted the cheek, shaped the lip to be slightly higher on the right side. We've done nothing to the left side so that you can see the difference, and I'm going to show Mila for the first time.
Oh my God. Wow.
And so as you can see, and then I'm going to show the camera, here your jawline is lifted.
Oh my goodness.
The cheek is lifted to the open edge of the eye. This side is still falling. And then we can see a little bit more of a loose jawline.
Wow. Oh goodness.
And so this will look this way for about 3 days with swelling, but as the swelling goes down, it will become very natural. No one will be able to tell we've done this except the patient will definitely notice that they look more youthful and more volumized.
Already.
Love it. So put your mirror down for just a moment, and I'm just going to explain for the camera. What we're seeing on this side is a deeper nasolabial fold, a small fall to the jowl or the jawline, an empty space in the under eye, where when we look at her dead on, so I'm going to have you turn to the camera, we can see an elevated cheek, a lifted apex of the cheek and under eye, a lift to the nasolabial fold, elevated, a slight height to the lip on this side, volume through the bottom so she doesn't have lines through the lower lip, but that doesn't give her any protrusion or duck face, but just a lift or elevation to the shape of the lip, not volume outwards. And this is what we've done. So this will look like it's flat and falling towards this area. You'll notice on this side instead, here's the lift and back and elevation to the eyebrow. So as you can see, Mila's cheeks are very full right now. Her lips seem even a little fuller than they're going to look in 3 days. So know with any of these procedures, there's about a 3-day period in which you're going to have swelling. She does have a slight bruise here. She'll be using arnica on in the next 3 days to get that to fade and go away. We did Botox, Radius, Volbella in the lips, and with all that we did, she only had this one spot that tended to get a little blue. That will go away in 3 days along with the swelling. So the way that we're going to have her take care of herself this evening is by using a product called Arnica that can get rid of swelling and bruising and mostly just calm the skin down. The other thing that I'm going to have Mila do is not drink out of a straw for the next 24 hours until her product has solidified. So she won't make any strong motions with the mouth. She can eat as normal, but no straws today. She can also lightly ice or cold compress as needed. You may also take ibuprofen if necessary the evening of your procedure for discomfort. In 3 days, all of her symptoms should alleviate, and we should be able to see the final result with lack of swelling and no discomfort.
back at Rebecca's clinic about 15 days after, right? And as you can see, I'm perfectly comfortable and looking fresh and really happy about my results. It was a very interesting process. I didn't know what to expect. I've done fillers for the first time, and I've let Rebecca take some decisions with what she wanted to do, taking risks because I was not sure what I really wanted to do. But she just guided me through the process in a powerful way, soothed me, and I accepted whatever her suggestions were for me. And I could say 15 days later, how wonderful, really. I mean, my level of my confidence, the way I'm enjoying, coming out into the world every day, it's just really was in effect already probably third day into it. So that was very exciting to see how immediately I had the softness and the fullness that I wanted, and nothing really severe showing on the face that demanded, staying inside and healing longer. So what happened, probably the most intense time was the second day, and Rebecca forewarned me about that would be probably the most inflamed time. I had some bruising, but it fairly quickly went away because she also suggested I take some arnica and put topical arnica as well, and that really worked magic. The first night and the entire second day, there was some inflammation. All I needed to do, I could have gone without it, but I did take ibuprofen, and that was it. The third day, really like a butterfly coming out of the cocoon. You could really see the transformation, and it's just so gradual and so fine and so beautiful that you feel like you have just woken up fresh, truly in the spirit of waking up beautiful. It's like you have woken up after a long, wonderful night of sleep, and there's freshness and plumpness and there's a certain radiance about it. That was very exciting. Other than that, frankly, I didn't have to worry about fourth day and onward. We just honored the process of staying like 10 days or a bit over to show up with final results. So what I'm noticing is, first of all, I have, fullness here and not deep lines right underneath my eyes, beautiful accentuation on my cheek lines. She gave me a little bit of fuller lips. This is just freshness. There's certain freshness that came with it that gave me beautiful lines, that gave me kind of radiant look. And I really appreciate the quality of Rebecca's assessment initially, and then real projection onto, she was 100% confident, even when I was a little bit anxious, of what I'm going to look like with a guarantee 10 days into it. So I can really only say it again, that she's a true artist among clinicians, and the way she approaches every individual, the way she understands, your lifestyle, your emotional motivation behind this, your aesthetic intention is truly remarkable. So here's to waking up beautiful. That's how I feel today.